The lung ultrasound exam is used to look for pulmonary pathology such as acute pulmonary edema, pneumonia, pleural effusion, or pleural abnormalities,
including pneumothorax. Please feel free to pause the video to look through this 2-page document that explains how to perform lung POCUS, save the images, and what lung pathology looks like on ultrasound. Lung ultrasound is a zonal ultrasound going through all of the lung fields. We begin with the right anterior superior section with the probe marker pointing towards the patient's head. We use the curvilinear probe in the lung setting. We begin superficially by assessing the pleura and then increasing the depth and the gain to assess the full lung fields. In a typical adult, we look for depths up to 20 centimeters and make sure we increase the gain so we can see the deepest part of the lung. Next, we move on to the anterior inferior section of the lung. Similarly, we find the 2 ribs and the pleural line and assess for pleural sliding. This excludes a pneumothorax. We then increase the depth to look at the full lung field, assessing for lung field abnormalities such as pneumonia and pleural effusion and B lines in acute pulmonary edema. Next, we have the right lateral superior area. Similarly, we follow the same system of initially looking at the pleura, checking for pleural sliding and abnormality, and then increasing the depth to look at the lung field. And the final section of the right lung is the right lateral inferior section of the lung. Here we assess the shallow view looking at the pleura. This view is often best for looking at small pleural effusions and small pneumonias. And similarly, the deeper view with increased gain is the best view to look for B lines and pneumonia and pleural effusions. We now repeat the process on the left side of the lung. Throughout all these views and all these zones, the probe marker is pointing towards the head. We always assess the pleura first to check that it's sliding and to look for pleural abnormalities, and then we increase the depth and increase the gain to look at the full lung field and assess for lung field pathologies. After the left anterior superior section, we look at the left anterior inferior section. Here often the heart can get in the view, so you can adjust the probe just above or just below. It is a good idea before performing lung ultrasound to go through the documents or go through a module to explain the difference between A-line profile and B-line profile. Here we're performing the left lateral superior view, assessing the pleura for sliding, and then similarly increasing the depth and the gain. And the final view to complete the 8-zone lung ultrasound method is the left lateral inferior view. The technique is the same and is symmetrical between the left side and the right side. The resources explain the abnormalities seen with the various pathologies of pleural effusion, pneumonia, and pulmonary edema, as well as pneumothorax. This completes the lung ultrasound exam.